And finally, Dr. Carla Sainz. She's the Regional Bioethics Advisor at the Pan American Healthcare Organization, which is the WHO's outpost for the region of the Americas. She has taught at the philosophy department at the University of North Carolina, Chapel Hill also, and she's an elected member of the Hastings Center Report and participates on a number of WHO panels related to COVID. So this is a topic dear to her heart.
Thank you, Zeke. Thank you, colleagues. It's great to be with you and participate at this dialogue. I want to start by highlighting the importance of a public health approach for the discussion of vaccine certificates and overall the discussion of public health interventions for COVID-19. We often see that an antagonistic approach predominates in these discussions, in which individual freedom is portrayed as some sort of absolute value against which public health restrictions are measured as some sort of evil that sometimes may be deemed necessary. But this is problematic, and we ought to do a better ethics analysis. We need to bring the moral value of public health to the discussion, and that's what a public health ethics approach entails. Public health authorities have the duty to protect the health of the public, and advancing the health of the public, maximizing health benefits, are values. They're ethically grounded. We're not balancing a good against an evil. We're balancing different competing goods, different values. By implication, the efficacy of the interventions we're discussing, whether proposed intervention like vaccine certificates are capable of achieving their aim, whether they're effective, these issues are not a technical feature of the discussion. They're not foreign to ethics. They're not foreign to the ethics analysis. They're an integral part of the ethics analysis. You may remember back in the day when in research ethics discussions, it was assumed as if the research protocol had nothing to do with ethics, and ethics was only about the informed consent process. I think we're to some extent reproducing a similar problem in the context of public health ethics. Ethics has to do with whether interventions work or not, whether they're capable of achieving the public health goal. So, and I know that there's been a prior session on the efficacy issue of these interventions, but I think it's important to highlight this public health ethics as a framework and the need for the fact that ethics, an ethics assessment has to be comprehensive. And even if we're focusing on issues pertaining to equity for this session. I also think with this regard, before I go to specific issues on equity, that it's worth highlighting that what we need to ensure is we have adequate evidence, robust evidence that an intervention works in order for it to be ethical. But that's also different from ensuring 100% success or 100% efficacy of intervention. Think about the driver's license example that Govin gave a moment ago. So driver's licenses are required because the duty to protect the safety of the public. So it's required to have a driver's license to make sure that people can drive safely. But this doesn't mean that we don't question the justification of driver's license because they're not capable of being 100% successful to preventing accidents. So the point is that, and this is another issue on which ethics is relevant, and we do not often bring ethics to the discussion, is that we need to identify what reasonable thresholds are, and that's a judgment call. There's no magic number. There's a continuum of risk, and where exactly we say that an intervention is justified based on risk. That we need an ethics assessment for that. We need transparent ethics analysis that is also communicated to the public. So this is an issue on which we have key variables that are continuously changing. You may remember that WHO issued in February an interim statement against requiring proof of COVID-19 vaccination for international travel based on the efficacy of the intervention and based on equity concerns. But you may also know that the IHR Emergency Committee met last July, on July 15th, and discussed, among other issues, the challenges posed by the lack of harmonization in documentation requirements for vaccination for international travel, as the previous panel has discussed. So it was also recommended that we expedite the work to establish proper updated means for documenting COVID-19 status for travelers. So this recommendation is responding to these evolving scenarios, there's still a lot to do in terms of ensuring equity and access to vaccine, but things are getting better. And the evidence on vaccines, not just because we know more about vaccines, but because we deal with different variants, is also changing. So I want to point out that the discussion about vaccine certificates for international travel, as has been presented in the previous panel, is not existing in a vacuum. It's not a case where we have nothing. And it's I'm thinking about Govind's table a moment ago. It's not just that we have border closure or open entry. We have this forest of existing requirements. And I think it's in this context of these existing requirements that we have to discuss vaccine as a strategy to lift or supplement these requirements progressively. And I think that the discussion, thinking about the differences in equity that Vardit has pointed out, which is really striking, thinking about a more complex model when we're supplementing or progressively lifting requirements is important. One thing we rarely say anything about is that the existing requirements come at a cost that's often not trivial for those traveling. Many people may not be able to afford those tests. In the majority of LMICs, tests are only paid for if you already have COVID symptoms. And that's different from vaccines that are paid by governments. And as a final point, I just want to bring another layer of complexity to the discussion about equity. The issue that has been presented before about the massive inequity in access to COVID vaccines at the global level is the main problem. Despite recent progress, at this point, in some countries, only about 5% of the people are vaccinated. So we know that lack of vaccine access has exacerbated already existing global inequities. And the question we have to ask ourselves is whether the use of vaccine certificates for travel is going to further exacerbate these inequities. And that's also taking into account Kate Manvery's point about the different vaccines and what additional challenges that may pose. But I want to highlight too that COVID-19 has not only brought death and disease, it also has brought poverty, loss of employment, massive socioeconomic problems. And low-income countries are particularly vulnerable to these problems. Being poor, you have less of a cushion. If you get poorer and you're already very poor, you're at a situation when you risk actual survival. And many of these countries rely on tourism as an important source of income. So I think that we have to have this discussion taking into account not only our perspective and our comfortable cushion for wealth, but also the perspective of low and middle income countries. And taking into account not exclusively the massive inequity in vaccine access, but also the fact that socioeconomic, even survival, may be at stake. And I think it's good that there's another panel focusing on this issue. Thank you very much.